Hello, I'm Tanaja Dorset, and this is my TED Talk about maternal health disparities. Imagine one of the happiest moments in someone's life becoming one of the most dangerous. For many women, giving birth should be a time of celebration, support, and new beginnings. Families prepare for months, picking out names, decorating nurseries, and imagining a future with their child. But for far too many women in the United States, pregnancy and childbirth come with serious and sometimes deadly risks. The United States has one of the highest maternal mortality rates among developed countries. Even more alarming, Black women are about 3 times more likely to die from pregnancy related causes than white women. And this is not because of genetics. It is not because of individual choices alone. It is because of deeper systematic issues. To make this more real, think about someone like Shamani Gibson, a young mother who died just weeks after giving birth due to complications that were not taken seriously in time. Her story is not rare. There are many women whose warning signs were missed, whose voices were ignored, and whose outcomes could have been different. This is not just a healthcare issue, it is about equity, access, and how we value human life. Today, I want to talk about maternal health disparities, why they exist, and what we can actually do to change them, because no one should have to risk their life to bring another life into the world. So, why is this happening? There is no single cause. Maternal health disparities are the result of multiple overlapping issues that build on each other over time. First, let's talk about access to healthcare. Not everyone has equal access to prenatal care, specialists, or even hospitals. Women in rural areas may have to travel long distances just to see a provider. Others may delay care because of costs, lack of insurance, or limited appointment availability. When care is delayed or inconsistent, complications like high blood pressure, diabetes can go undetected. Next is quality of care, which is just as important as access. Even when women do seek care, they might not always receive the same level of attention or treatment. Research shows that Black women, in particular, are more likely to have their concerns dismissed or minimized. Symptoms like pain or shortness of breath may not be taken seriously, which can lead to dangerous delays in treatment. This connects directly to implicit bias in healthcare. Implicit bias refers to unconscious attitudes or stereotypes that affect how people are treated. In healthcare, this can influence how providers listen, diagnose, and respond to patients. It does not always come from intentional discrimination, but the impact is still very real. Another major factor is chronic health conditions. Conditions like hypertension, diabetes, and heart disease increase the risk of complications during pregnancy. These conditions are more common in certain populations due to long term inequities in healthcare access, nutrition, and living conditions. We also have to consider social determinants of health. These are the conditions in which people are born, grow, live, work, and age. Things like income, education, housing, and neighborhood safety all affect health outcomes. For example, living in a high stress environment or dealing with financial instability can lead to chronic stress. For example, living in a high stress environment or dealing with financial instability can lead to chronic stress, which has been linked to poor maternal health outcomes. And then there is postpartum care, which is often overlooked. Many people think the risk ends after the baby is born, but that is not true. A large number of maternal deaths happen in the weeks and months after delivery. However, many women only have one postpartum visit, if that. Without ongoing monitoring, serious complications can be missed. All of these factors are connected. When you combine limited access, bias in care, underlying lying health conditions, and social inequalities, you create a system where certain groups are placed at much higher risk. Now that we understand the problem, let's talk about the solutions. Because this is not hopeless. In fact, many maternal deaths are preventable. First, we need to expand access to healthcare. This includes ensuring that all women have access to affordable prenatal and postpartum care. Expanding Medicaid coverage is one major step, especially extending it beyond the current postpartum period so women can continue receiving care after birth. Second, we need to improve the quality of care and address bias. Healthcare providers should receive training on implicit bias and cultural competence. Patients need to feel heard and respected. Listening to patients and talking their concerns seriously can literally save lives. Third, community-based systems can make a huge difference. Doulas, midwives, and community health workers provide support that goes beyond clinical care. They help advocate for patients, provide education, and offer emotional support. Studies show that having this kind of support can lead to better birth outcomes. Fourth, we need to strengthen postpartum care. Instead of a single follow-up visit, there should be ongoing care and check-ins during the postpartum period. This includes mental health support as well, since postpartum depression and anxiety can also impact overall health. Another important solution is patient education and empowerment. Women should be informed about warning signs like severe headaches, chest pain, heavy bleeding, or difficulty breathing. They should also feel empowered to speak up and seek help when something does not feel right. Finally, we must address larger systematic issues. Improving maternal health also means addressing poverty, education gaps, food insecurity, and housing instability. These are long term challenges, but they play a critical role in shaping health outcomes. Maternal health disparities are not just numbers on a chart, they represent real women, real families, and real losses. Behind every statistic is a story that could have had a different ending. No woman should feel ignored when she says something is wrong. No woman should receive lower quality care because of her race or background. And no family should have to experience a preventable loss. This issue requires awareness, accountability, and action from all of us, whether we are healthcare providers, policymakers, or simply members of a community. So I want to leave you with this question. What would it look like if every mother received the care, respect, and attention she deserved? Because when we improve maternal health, we are not just saving mothers, we are protecting families, we are strengthening communities, and we are investing in the future. Thank you.